Thanks for watching On Call for All Kids. Today we're discussing the COVID-19 vaccine and pregnancy. We'll be discussing how COVID-19 is affecting pregnant women, how the vaccine for moms to be helps protect them, and clarify myths associated with the vaccine and pregnancy. I am joined by Dr. Jose Prieto. He is the Medical Director of Maternal Fetal Medicine here at Johns Hopkins All-Children's Hospital. And it is great to see you, Dr. Prieto. What a very important topic right now.
Likewise, Ashley, thanks for having me.
So what are you seeing in clinic as far as pregnant women coming in with COVID, and how are they potentially differing from women who are unvaccinated?
So in the state of Florida, and indeed in the Tampa Bay region, we are seeing a clear and significant surge in COVID-19 infections. We're seeing a surge in hospitalizations, in ICU care, and in deaths, regrettably. So unfortunately, in my practice, where we take care of high-risk pregnant patients, we have seen an uptick in pregnant patients who have required hospitalization and ICU care. And, for me personally, it's heartbreaking to see a pregnant patient who COVID-19 and because of that cannot hold her baby after birth. It's a very heartbreaking situation because they need to be in isolation. So many times these babies are removed from their mother, and they don't get to spend these initial skin-to-skin time that is so important. We have seen a lot of pregnant patients recently with COVID-19 infection. Some have been very sick. Some have required ICU care, and regrettably, some have passed away. Pregnancy seems to be an independent risk factor for serious illness when compared to the unvaccinated patient. The vaccines have been shown to be very effective and safe in pregnancy, and we strongly recommend vaccination. The vaccines, I think what's most important about the vaccines is that they protect your lungs when you're vaccinated, and they help prevent serious illness, ICU care, including ventilator support, and even death.
How does the COVID-19 vaccine really affect a woman's immune system?
So what the vaccine does is it activates the patient's immune system to fight the virus. And what it does clinically, which is so important, is that it really protects you from serious illness and death. And the preliminary studies suggest that that is the case with all three vaccines that are on the market: the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine.
Some pregnant women have voiced their concerns, worrying that if they get the vaccine that they might have a miscarriage. Can you clarify this for us?
So there are some preliminary studies on vaccination in pregnant patients, and the preliminary studies are clear that pregnant patients who are vaccinated are not at increased risk for miscarriage or infertility, which is also a common a concept out there. And again, this includes all three of these vaccines.
What effects does the vaccine have on a nursing mother and the baby?
So there's limited data on lactating patients who receive the vaccine, but the data that we do have suggests that the antibodies that the moms make after being vaccinated will pass into the breast milk and to their newborn babies. It's very important to also recognize that these vaccines are not live virus vaccines, so there's no risk of getting COVID-19 from the vaccine, and there's no risk of passing it on to your baby. So if you do get vaccinated while you're lactating and breastfeeding, you should continue to breastfeed your baby.
All right, Dr. Prieto, thank you so much for joining us. So big takeaway is if you are a mom-to-be, go ahead and get vaccinated. It could potentially save your life.
Yes, it could. Absolutely.
Thank you, and thank you for all you're doing. I know it's very difficult times out there right now. And thank you all so much for joining us today. Don't forget, you can also visit our website. It's HopkinsAllChildren's.org/coronavirus, and you'll find a lot of great resources on COVID-19 right there. We'll see you next week.